Lucentis is one such compound and consists of a fragment of an anti-VEGF antibody. It has been approved through most regulatory agencies across the world and was specifically developed as an ocular-grade medicine to be used in the eye.
Both were tied to similar low rates of endophthalmitis, a serious eye infection that can cause blindness. Researchers compared the risk of endophthalmitis in patients who received eye injections of bevacizumab, which can be used in the eyes at around $50 per eye injection, and ranibizumab, which can cost up to $2,000 per eye injection.
The main treatment for wet macular degeneration is an injection of medication into the eye. This medication is delivered close to the retina after freezing and cleaning the eye, and most patients experience only minimal discomfort.
Based on research published in the New England Journal of Medicine, it can improve vision in nearly 4 out of 10 patients. This medication is delivered into the eye by a procedure called an intravitreal injection. In this delicate procedure, a tiny needle enters the eye through the small space created by the back of the lens and the front of the retina. Once the needle tip is in the vitreous or the jelly of the eye, 1/20th of a cc is injected into the eye. This medication is dosed monthly, and numerous injections are needed to manage this condition. This medication is expensive, and its retail price is around $1,700 in Another medication called Avastin is also commonly used by retina specialists to treat the wet form of macular degeneration. Avastin has not undergone the same level of scientific testing that Lucentis has, in part because it is not approved for use in the eye by health regulatory bodies like Health Canada or the FDA. One significant advantage of using Avastin, however, is that it costs significantly less than Lucentis, commonly retailing for between $100 to $300. Our research published this month in the Canadian Journal of Ophthalmology shows that there may be a higher risk of severe intraocular inflammation following injection with Avastin when compared to Lucentis. To perform our study, we reviewed a consecutive series of patients who underwent treatment with either of these two medications. We reviewed nearly 1,600 consecutive injections over a 3-year period and found that those who received Avastin were 12 times more likely to develop a serious inflammation within the eye. Many patients had severe pain 1 to 2 days following the injection and presented to us with pus located in the front of the eye or the vitreous. On average, patients who had this complication lost 6 lines of vision on an eye chart. This complication was seen following injection with Lucentis in only 1 case, but ultimately this patient ended up gaining vision. Cases of severe intraocular inflammation have been noted in many other centers, and both Health Canada and the Canadian Ophthalmology Society are now actively tracking adverse events seen with these medications.
Okay, gonna look up and to the right. Here, to the right.
You should be aware that side effects can include inflammation, infection, and stroke. If you have worsening pain and eye redness following an intravitreal injection, you should seek urgent medical attention. For Insider Medicine, I'm Dr. Sanjay Sharma.